and the CRT was less than 2. The mucous membrane colors were pink. The pain is 0 to 4. Body condition score was a 4 out of 9. Since this patient's diagnosis on August 10th, 2020, she has been coming in every 4 to 6 weeks for a recheck. So she came in on June 2021 for a recheck of a physical exam and any other concerns. As a technician, I grabbed a history, seeing what the concerns were, what medications she was on, and then I went ahead and told the owner what our plans were. So she was going to be getting a physical exam from the oncologist. Then we're going to do an abdominal ultrasound from an internal medical doctor. She already had x-rays done at a different hospital, so those were transferred over to Dr. Bergman. And then I drew blood for a recheck of a CBC/chem from her jugular. And then I explained to the owner that the results will come back in about a day or two, and the doctor will call with them. The owner dropped off the patient, so it was my job to check up on the patient frequently, and the owner brought food, so we fed her lunch. The owner stated that this patient has been on Palladia, which has been working well within the last year. As the doctor states, it's a drug used to treat mast cell tumors, a common form of cancer that affects dogs. She is also on Entice 30 milligrams per milliliter by mouth, 1.5 milliliters once a day, every 24 hours as needed to stimulate the appetite. The client said that this patient only eats chicken thighs and hash browns. Now, for the Palladia, it is given 15 milligrams tablets twice a day, every Monday, Wednesday, and Friday. For this specific tablets, it is important that gloves are being worn and that they are not crushed or broken. Due to the type of chemicals that it has, it can become harmful to humans, especially ones who are pregnant. She is also on Serenia 24 milligram tablets, given once by mouth every 24 hours as needed, as that prevents nausea and motion sickness. She's also on metronidazole 250 milligram half tablets twice a day, every 12 hours as needed to treat the diarrhea. And also is on Prilosec 20 milligrams, given half tablets, which is 10 milligrams every 24 hours with food. And this is an over-the-counter antacid medication that can be found at a pharmacy. After this patient was done with the physical exam, drawing of blood, their owner was here to pick up, so as a technician, it is my job to discharge the patient. When discharging the patients, I explain everything that was done to the owner. I go over the medications, how to give them, how many times, if food is needed, and what doses to give. I explain to the owner that the patient may be feeling a little bit tired due to what we have done with them today, and of course the doctor will call with the results of the blood work as soon as possible. As for oncology, as this specific oncology patient, she should reschedule an appointment within the next 6 weeks. I also explained that the medication Palladia must be given with gloves, and anyone who is pregnant should not be handling or administering this drug. Now, as shadowing during this as a technician, I notice it is important that anyone dealing with oncology patients should be wearing PPE, such as gowns, masks, goggles, and gloves to prevent other diseases, especially since our patients are immunocompromised, and the oncology department has specific gloves for our patients and use of drugs. All of these terms were either brought up in appointments or during our treatments. So, for instance, amoxicillin, I filled this medication with my mentor for a patient who had a UTI, so I know that it is an antibiotic for certain bacterial infections, and it comes in tablets and capsules. The next one is Serenia. I see this a lot used during ER. It is an anti-nausea. It can come in an injectable or tablets. We mostly give the injectables when the patients are in hospital, sub-Q. I actually gave this injection to a dog sub-Q after we induced vomiting because it ate a grape. So after we induced the vomiting, we gave it the anti-nausea to stop the vomiting. Next is Clavamox. I know that this can be used when it can treat infections. So for instance, if anything is found in cuts and wounds in the mouth, so this was prescribed to a patient who actually had an infection in the mouth. The next one is Cytopoint. My dog actually gets this injection once a month. It is created to aid dogs with skin allergies. So I gave this injection to a dog sub-Q who came into in an appointment for a doctor's visit due to allergies. And then we have doxycycline, which is an antibiotic used to treat infections like Lyme's disease, chlamydia, Rocky Mountain spotted fever, and bacterial infections. So I filled this medication with my mentee after a dog's 40x snap test in-house came back positive for Lyme's disease. Then we have Entice. I also see this on ER a lot. It's an appetite stimulant for dogs to obviously stimulate their appetite. I gave this to a patient on ER that was not eating. And then we have gabapentin. My dog is also on this before going to the vet. It is to relieve pain and can be given to animals prior to surgery. I've given this medication to a patient after surgery on ICU. And then we have metronidazole, which is an antibiotic to treat diarrhea. So a dog came in on GP for a visit due to diarrhea, and we prescribed it metronidazole. So I helped fill that medication. And then we have Onsior, which is a post-operative pain and inflammation associated with orthopedic surgery or ovirhysterectomy and castration in cats. So I gave this tablet to a cat after he was neutered. Next we have Panicure, which is a dewormer containing fenbendazole and is most often used to remove hookworm, roundworm, tapeworm, and whipworm. I filled this medication for a dog who was recently adopted and had hookworms. Then the next one is prednisone, which is an anti-inflammatory and immune suppressant. It can treat animals with arthritis, pet allergies, dermatitis, asthma, and adrenal insufficiency. I filled this medication for a cat who had an upper respiratory infection. And then we have propofol, which can be used for sedation, induction of anesthesia, and maintenance of anesthesia in small animal patients. So I actually helped administer this IV slowly between 4 to 6 milligrams. It was given to a dog before a spay, so it could completely knock out before the procedure. And I also helped administer this to a cat who was getting x-rays and needed to be sedated. Then we have Rimadyl, which is also known as carprofen. It's a non-sterile anti-inflammatory drug of propionic acid that includes ibuprofen, naproxen, and ketoprofen. They come as capsules or tablets, chewables, and injectables for cats and dogs, and this was prescribed as a chewable for a dog that came in for pain in the hind leg. Then we have Tramadol, which is an oral tablet used to treat severe pain, and this was prescribed to a dog after surgery on its leg. And then we have trazodone, which is a serotonin antagonist reuptake inhibitor, also an antidepressant that is used to treat behavioral disorders. My dogs are also on this. So many dogs were prescribed this before the 4th of July due to the fear of fireworks. And lastly, we have Xenequin, which are tablets that are indicated for the treatment of skin and soft tissue infections. So I filled this medication for a dog who had skin issues. Overall, my experience at Katona Bedford Veterinary Center has been amazing. I've shadowed many procedures, such as dental, spays, and neuters. I got to see the different areas of the departments, such as oncology, GP, internal medicine, and the ER. I think being on ER is very exciting because you don't know what you're expecting, so you see a lot of different things, whereas GP, it is very repetitive, but I also liked being on GP, so I feel more confident in giving vaccines and getting TPRs and drawing blood. I feel as practicing on GP with drawing blood has definitely made me feel better about it. I also learned how to do things such as giving medication, cleaning ears, nail trims, and other things like that, and I can't wait to look forward to learning more and hopefully be a technician someday at this place. Thank you.